Welcome to this lecture, and I'm plunging in talking about rubber ducks. Yeah, really? Oh, I would add that I'm going to be talking a bit about some art therapy exercises, and I hope that you actually do these while you're listening or watching the lecture. Anyway, rubber ducks. Art therapist Kathy Malchiodi introduced her rubber ducks and masks into the military. No, not to serve in the military. She's an art therapist who was working with the military, and she was using rubber ducks and masks as therapeutic exercises. She saw this as once in a lifetime maybe, or certainly the first time it had been tried. She saw working with the military and introducing her rubber ducks as an opportunity to see the profound effect on our well-being expression without words can have. Now, this profound effect is not only for those who've experienced trauma like post-traumatic stress syndrome, but how it can have beneficial effects on the well-being for all. Now, obviously, it wasn't just rubber ducks and just masks, but this lecture, this course, is about art therapy, painting, and ducks. So I'm going to deal with this lecture, rubber ducks. So, back to rubber ducks. When we use our senses other than speech, so not me speaking, but communicating, turn the sound down, communicating with hands or body language or movement, when we use our senses other than speech, there's something rather primal, takes us back to when we couldn't speak, or at least we couldn't communicate effectively with words. Before we learn to actually speak, to say a few words, we experience the world around us through other senses. Touch. So we're lying in the pram. Now, we can't communicate except by screaming, but we can feel the movement if the pram is being pushed. We can feel whatever clothes we have. We can feel the side of the pram. We can taste and smell and feel the air. So we experience the world around us through touch and taste and smell, and if we're being pushed in a pram along the road, or along the pavement I should say, not the road, get hit by a car, along the pavement, then we also experience the world through sound, traffic, or being pushed in a forest, for example. Hear the birds singing. So you're in your pram, you're out in the fresh air, you hear the birds singing, you can see the trees, the grass, you can feel a sense of calm, only to then splinter it, your baby remember, with your attempt to communicate or to register pain or enjoyment as you emit noise and noise, which may be noise of laughter. Or noise of crying because you're hungry. Now, as we grow, these senses become less dominant. For example, when we're very young, we learn love through the touch of a parent. Our mother and father, but closeness is probably greater to the mother, holds us, cuddles us when we are warm, or cuddles us when we need warmth, or when we're feeling unloved or insecure. Remember, we can't communicate with words. We're very, very young. So we learn love through the touch, through the look of our parent. We soothe ourselves with the soft texture of a toy. Yes, you can see how I'm getting round to rubber ducks. So we soothe ourselves with the soft texture of a toy. And we express ourselves, perhaps giggling and gurgling and waving our feet around and cackling, and smiling and everything, but not making words. So we express ourselves without using, at least recognizable words. We may think we're communicating, ga, 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 yeah.
A calling cry. Ever heard your baby cry for about 5 to 6 seconds and then pause for the next 20 seconds? They're not watching a commercial. That's a calling cry. This means that your baby has been alone for a while and now desperately needs your attention. If you don't respond right away, you'll hear this fascinating cycle of crying a couple more times.
Now, as we grow into adults, we take with us, for a certain period of time, the world that we already know. This is the world inside of us that knows the world, remember, through touch and taste and smell and sound, and we know this world without words. And if we can tap into this, rubber ducks, then that means we can access parts of our brain deeper than language, spoken language, and beyond the rational. And tapping into this can be therapeutic. I quote, "We know that when people are traumatized, many of them literally cannot communicate through words, because what is happening to them is too difficult to speak." Years and years and years ago, I was cycling along on my bicycle, November the 5th. I can remember this because it was November the 5th, to get some fireworks. And I needed to stop suddenly. And I only put the front brake on. So I went over the handlebars, landed on the ground, smashed my teeth. And when I was taken to hospital, they asked me my name. And weirdly, I remember this to the day, I couldn't say it because I was still in a sort of sense of shock and bewilderment. And so when, as I read from Kathy, when people are traumatized, many of them cannot communicate through words because what is happening to them, or what did happen to them, is too difficult to speak. There is something that they've seen now in brain imagery, that when you ask a person to talk about a traumatic event, there's a part of the brain called Broca's area.
Welcome to 2 Minute Neuroscience, where I explain neuroscience topics in 2 minutes or less. In this installment, I will discuss Broca's area. Although the anatomical definitions of Broca's area are not completely consistent, it is generally considered to make up some part of a region called the inferior frontal gyrus, which is found in the frontal lobe. In the vast majority of individuals, Broca's area resides in the left cerebral hemisphere. Broca's area was named for the physician Paul Broca, who first identified the region as playing a potentially important role in speech production. Broca based this hypothesis on case studies of patients who had damage to the area and also displayed a deficit of speech. The particular condition Broca observed came to be known as Broca's aphasia and involves a deficit in the ability to produce language. In patients with Broca's aphasia, reading and writing are also often impaired, but language comprehension is typically relatively preserved. The precise role of Broca's area in language production, however, is still being debated. In other words, damage to Broca's area can disrupt language production, but nobody is quite sure exactly what language-related function is lost to cause that disruption. Some have hypothesized Broca's area is involved with producing movements, like of the tongue and mouth, that allow speech to be produced. Others have argued it is involved with syntax, grammar, verbal working memory, or all of the above. Broca's area is also thought to have a variety of other linguistic and non-linguistic functions. It has been recognized as playing an important role in language comprehension, movement, and even understanding the movement or actions of others. Thus, although Broca's area does appear to play a role in language, the overall function seems to be more complex.
And this has to do with language. And when you've been traumatized, perhaps dealing with the military, you've seen people die, explosions, body parts, etc. When you are traumatized, that Broca's area that's to do with language goes offline. My speculation, when people start to express through visual art or music or movement something very sensory and action-oriented, those language parts start to come back online. So sensory and action-oriented, we're coming to the rubber duck, there is a purpose to this. So sensory and action-oriented, expressing yourself through visual art or through music or movement, then the language parts start to come back online. Now, movement, especially dance, has been proven to be of great use to reduce stress, but also of great use in dealing with neurological ailments such as dystonia, for example. And so when you start to express yourself through visual art or music or movement, action, language parts start to return. But why is this? Trauma is a sensory experience, so we often need to use these senses. Now, I'm going to be developing this in the next lecture, in particular looking at the study with the military, and I haven't forgotten the rubber duck. We've also got to come on to painting, the painting of a duck and ducks as a totem, reducing anxiety, reducing stress. But the next lecture is all about post-traumatic stress in the military. But don't forget the rubber duck, and don't forget the masks.